Hi, everyone. So today we're going to be talking about cystic fibrosis and kind of just a typical case analysis on it. And that is our topic for today. So we'll kind of go over what a typical case may look like, relevant anatomy and pathophysiology, diagnosis and treatment of cystic fibrosis, its impact on daily occupations, and how when the disease progresses, how it can change said occupations, and then we'll go over some adaptive techniques and interventions. So, a typical case, here is our man with cystic fibrosis. So, a 26-year-old male diagnosed with cystic fibrosis or CF at the age of 2. He has been experiencing some chronic symptoms because this disease is chronic and genetic. So he has been experiencing persistent diarrhea due to salt loss in his body, frequent wheezing and cough. He's had multiple diagnoses of pneumonia and other lung infections, and he's also had the inability to gain weight despite having a good appetite, which we'll go over that a little bit later. So, just a brief patient history. Our patient has received numerous types of palliative care, so symptom management, but has experienced complications such as rectal prolapse, pneumothorax, deficiency, and nasal polyps. These are all very common in someone who lives with cystic fibrosis. Our patient is currently seeking treatment for a CF flare-up known as a pulmonary exacerbation, which is the worsening of symptoms. So just to go over some brief pathophysiology before we get into um, the relevant anatomy. So CF is a genetic disorder. It is a mutation in the CFTR gene, and this gene is in charge of encoding a protein that transports chloride ions within your body. So when there's a disruption in this protein, it disrupts the chloride ion transport, which leads to a depletion of chloride ions in the extracellular fluid, and then there's an excess of chloride ions within the cell. So the lack of ions in the extracellular fluid means that water is going to be drawn out of the cells and the cells are dehydrated. This dehydration is located on the airway surface, and this leads to a production of sticky mucus in organs such as the lungs and the pancreas, which is where some of the digestive issues come from. This Your body is supposed to be able to remove some of this mucus from your airways, and water is supposed to be drawn out, but because the mucus is too viscous and sticky, um, it's hard to draw out some of that from the cilia, and it adheres to the airway surfaces, making it sticky and leading to complications like being hard to breathe, not being able to produce enzymes for digestion, and more. So here's just a little image just to clarify what kind of the mucus lining the airway surface looks like. So on the left is a normal log with this mucus layer that is thin. The bronchiole looks how it's supposed to, looks healthy, and the alveoli also look normal to participate in respiration. However, people with CF, you can see on the right, there's a lot of mucus that just accumulates on the airway surface, and it also obstructs the bronchioles and then the alveoli as well, making respiration and ventilation more difficult. Some relevant anatomy with cystic fibrosis is a lot of issues with the digestive and respiratory systems. So within the lungs, the mucus buildup causes breathing problems due to obstruction. The upper lobes of the lungs are usually affected, and this could also lead to more incidents of chronic infections such as pneumonia. The pancreas, again, mucus buildup in this area as well. It prevents the release of digestive enzymes such as pancreatic juice from the pancreas, and therefore the intestines cannot digest food due to the lack of enzymes. And a lot of the time, you'll see undigested food within the intestines due to the lack of these necessary enzymes. And then also the liver has also been researched and shown that it's affected by CF. The mucus can block bile ducts and it prevents bile from leaving the liver in order to aid in normal digestion, and it also causes some inflammation with that as well. So with the lungs, mucus buildup causes breathing problems, intestines and pancreas, liver, and the digestive system, um, hard to digest foods, which is what you see with the diarrhea and the inability to gain weight despite a good appetite. So because this is a genetic disorder, we thought it would be pertinent to kind of share how it's inherited. So someone is diagnosed with CF if their parents have at least one copy of the mutated gene. So it means that either parent is either one has CF themselves or is a carrier. And this mutation is located on the seventh chromosome. So if you can see on the image on the right, these two parents both carry the mutated CFTR gene, and these are the chances of having a child with cystic fibrosis or being a cystic fibrosis carrier. So 25% chance for a child having no cystic fibrosis, same for a child with CF, and then a 50% chance for the child becoming a carrier themselves. There are a couple ways you can diagnose CF. So one way is to do a newborn screening with a blood spot test. It screens for abnormalities that could indicate CF, such as high IRT levels. And then this will also indicate and will test if the CFTR mutation is high due to these high IRT levels. The sweat test is kind of the gold standard test for diagnosing CF. It's essentially the amount of salt in a person's sweat. High levels of salt indicate cystic fibrosis. So if you can see on the right, this is kind of just a table explaining. So if a person has 60 or greater millimoles per liter of chloride in their sweat, that would result in a cystic fibrosis diagnosis. Additionally, some genetic testing can be done. Blood or saliva samples can be checked for a CFTR mutation. There are a couple ways to treat CF. Unfortunately, there is not a cure for it at the moment. So one way is to do chest physical therapy, such as massage, percussion, and vibration to loosen and expel mucus from the lungs. Airway clearance devices such as OPEP machines or vibrating vests. When you put it on, it vibrates to help loosen the mucus and clear it out orally. Exercise is super important. Regular physical activity can improve lung functions and airway clearance. Some medications are also given to patients with CF, such as antibiotics, bronchodilators to dilate the bronchioles, mucus thinners to thin the mucus, enzyme supplements to help digestion, and CFTR modulators to get right there at the protein encoding to help loosen mucus. Nutritional support is also recommended, having a high calorie, high fat diet with vitamin supplements to ensure adequate nutrition, since a lot of the time with CF, patients are unable to gain weight due to the lack of enzymes that help break down their food and take in the good nutrients. Regular checkups are also advised for monitoring lung function, detecting any infections, and adjusting the treatment plans as necessary.
So, with cystic fibrosis, there's some difficulties with engaging in occupations. The first is some respiratory limitations. So, like Rachel said earlier, one of the most prominent effects of CF is on the respiratory system, which is where the thick mucus accumulation leads to frequent infections, wheezing, and coughing. And these respiratory challenges can result in a decreased stamina and endurance, which makes it difficult for these people with cystic fibrosis to participate in physical activities, whether it be for work, school, or leisure. In our case, he experiences frequent wheezing and coughing, which can limit his ability to engage in physically demanding tasks or even routine activities like walking or climbing the stairs. He also has some gastrointestinal challenges. So these lead to symptoms such as persistent diarrhea and difficulty gaining weight. This can result in nutritional deficiencies and fatigue, which further impacts his ability to maintain a regular school or work schedule. The chronic nature of these issues can lead to social isolation as well, because they may feel embarrassed or uncomfortable in social settings due to their symptoms. The disease progression. So as it goes on, he'll experience more physical limitations. As CF progresses, patients may experience worsening lung function, increased fatigue, and other physical symptoms such as persistent cough and respiratory infections. These symptoms can limit the type of jobs they can perform, which often necessitates a shift to less physically demanding roles. For instance, while individuals with CF may initially hold positions that require physical stamina, they won't be able to hold these jobs in the future. They may have to transition to some sedentary jobs, like an office job, to accommodate their declining health. Next is increased absenteeism. So their need for frequent medical appointments and hospitalizations can lead to increased absences from work or school, and studies indicate that individuals with CF may miss significant amounts of work due to their health needs, which can affect their job security and career advancement. These absences can also lead to a perception of decreased productivity and potentially impacts their relationships with employers and colleagues. Job retention and career development is the next one. So despite these challenges, many individuals with CF manage to retain employment. However, the nature of the work that they do may change, with a tendency towards part-time roles or jobs that require more flexibility, since they do have frequent medical appointments and hospitalizations. So this shift can limit how many career development opportunities, such as, oh, this can affect their career development opportunities, because individuals may find it difficult to pursue promotions or additional responsibilities due to their health. The next is psychosocial factors. So the psychosocial impact of living with a chronic illness like CF can also impact occupational choices. So patients may experience anxiety, depression, and social isolation, which can further affect their work performance and job satisfaction, as well as their overall quality of life. The emotional burden of managing a chronic illness can lead to burnout, which makes it challenging to maintain a constant work-life balance. And finally, workplace accommodations. So as patients navigate their occupational lives, they may require specific accommodations to manage their condition effectively. This can include flexible work hours, the ability to work from home, or modifications to their work environment to reduce exposure to respiratory irritants. So employers who provide such accommodations play a crucial role in supporting the continued employment of individuals with CF.
So now thinking about some intervention plans, like we mentioned before, it's important for patients with cystic fibrosis to participate in exercise because it helps clear the airway. But on the other hand, individuals with cystic fibrosis often limit their physical activity due to persistent wheezing and coughing. Over time, this can lead to muscle deterioration, increased shortness of breath, and reduction of exercise tolerance. However, incorporating exercise such as swimming can offer some significant benefits for these individuals. So swimming helps clear the lungs of that thick, sticky mucus like we talked about before. And so this can help promote better respiratory health for this patient. Excuse me. And it has also been found that swimming can improve just overall health and well-being and enhances the quality of life for these individuals as well. Additionally, swimming helps build exercise endurance, making it easier for individuals to manage their condition and clear their lungs more effectively. And then swimming is also a great way to participate in physical activity in a way that's easier on the body because it reduces the stress on joints and muscles. So it makes it easier for them to participate in a way. And then swimming also takes place in a humid environment. So being in that kind of environment can also help clear the airways by keeping them moist and, helping it expel out of their lungs a little bit easier. And then in terms of intervention regarding mealtime, individuals with cystic fibrosis typically experience malabsorption issues, this leading to breakdown of fats and muscle to provide energy instead. And so an intervention in regards to mealtime could be focused on structured meal planning, and this can include educating the patient as well about easy to prepare, high fat and high calorie meals that can meet their nutritional needs. And then this intervention can also include easy to follow step-by-step meal recipes. So it's again easier on them and then gets them to want to participate in meal prepping as well. And then to keep track as well to see if the intervention over time is working, we can also record weekly weights to see how that's fluctuating. And then in regards to the environment, there are some adaptations that we can make because individuals with cystic fibrosis are often short of breath and may struggle to do their ADLs because it requires high energy. So as occupational therapists, we can work on energy conservation and slowing down the pace of which they are doing their ADLs. So one thing that we can focus on regarding bathing is using shower chairs. Standing for a long period of time and reaching over their heads to wash their hair can become tiresome. So using chairs can help conserve energy and minimize physical strain during bathing. Another adaptation that we can use is through kitchen modification. So we can have them reorganize the kitchen, making like healthier snack options and nutritional needs, like what they need at like eye level. So it's easier for them to grab and use. And then again, not causing the physical strain for needing to go run around all over the kitchen to grab the things that they need. So making that modification would be beneficial. And then lastly, staying clean is also extremely important for those with cystic fibrosis due to the risk that they take with getting germs in, and so we want to decrease the risk of infection. So keeping a clean environment is really important. So to do this and to make it easier to conserve energy, we can have them use extendable dusters, laundry carts that have wheels on it so it's easier to push, and then having the use of robot vacuums that can vacuum themselves would help increase the cleanliness of the environment while also decreasing physical strain, and then overall conserving that energy as well.